Well, Medicaid expansion is a huge policy issue for us. With the Affordable Care Act coming online, the Affordable Care Act, by all indications, is here to stay and is now a part of the fabric of our community. And so we need to move past the political discussion about it into the practical portion of how to implement that. So the Affordable Care Act, obviously we have a Healthy Communities Wind-Out is a big initiative I've been involved in. My predecessor, Joe Reardon, and I helped establish Healthy Communities Wind-Out. That Healthy Communities Wind-Out came out of a 2009 Kansas Health Institute report that ranked Wyandotte County 105th out of 105 counties in overall healthiness. They used about 43 different metrics to come to that assertion. One of them is access to health care. So we've formed 5 task forces out of Healthy Communities Wind-Out that continue to work. One is communication, one is education, another is healthy infrastructure, which deals with complete streets and other trails and sidewalks. Another is access to healthy food, dealing with some of the food deserts in our community and building new grocery stores. But the 5th one is access to health care. And one of the reasons that we're ranked last in overall healthiness is too many of our citizens are uninsured. The last count was around 32,000 of our 150,000 residents are without health insurance. That's about 20% of our population.
Of the city or the county?
32,000 in the county.
County.
It's a county health ranking.
Okay.
So we have 32,000 uninsured individuals in Wyandotte County, the highest anywhere in the state, percentage-wise. And there are a couple things that are going to help that. One, the Affordable Care Act, the new enrollment, we have 16,000 of those persons are eligible for enrollment. So we're unrolling out of Healthy Communities Wyandotte a massive initiative to enroll as many of those 16,000 as possible. What's going to happen, though, is those 16,000 actually have a higher income than the ones who would benefit from Medicaid expansion, because expansion of Medicaid would cut our number in half again. And it's the poorest members of our community who don't have access to health care. And this is one of the big issues. It's a drain on our hospitals. Bethany Hospital has already closed in Kansas City, Kansas, and has now been bulldozed, in large part because of its care for the uninsured, who were unable to pay, and it just overwhelmed the hospital.
Go to KU Med, I guess.
You go to it's overwhelming KU Med, it's overwhelming Providence. Nationwide, uninsured persons are overwhelming our emergency facilities. And we already know that emergency facilities is not the right way to care for anyone.
I think that's part of what the ACA was about.
That's exactly right. Now, the ACA creates other problems, but it solves this one. And this one is access to health care. And in terms of getting people what they need in terms of primary care physicians, and to make sure that they're not going into the emergency room after they've been sick for too long, but they're actually getting care earlier in stages, which is much more cost effective. It's not only the right thing to do, but it's also more cost effective. The expansion of Medicaid, then, is pretty fundamental to our community when we have 8,000 persons who could benefit from that expansion. And really, when you think about it, it's not just those 8,000 of the very poor, the poorest of the poor in our community who would benefit. It would also be a huge economic development engine. When you think about a $3 billion annual investment by the federal government into the healthcare infrastructure of our state, you start to think about economic development with jobs, with the kind of healthcare-related businesses that come out of that, and the direct benefit to our hospitals. Our hospitals, not only our urban hospitals, but our rural hospitals. There are so many interested parties, but just from an economic development perspective, it's the right thing to do. From a broader healthcare perspective, in terms of sustainability of the healthcare system in Kansas, it's the right thing to do. And for the very poorest of the poor, it's the right thing to do.